The United States has hit another somber milestone in the ongoing COVID-19 pandemic. 800,000 Americans have died, according to Rutgers. This is a live look from our nation's capital, where lawmakers plan to observe a moment of silence in honor of those lives lost, coming up very shortly, 5:15. Many of the people who died this year were unvaccinated. As the nation faces a new threat in the Omicron variant, News4JAX consumer investigator Lauren Verno is taking a closer look at how well vaccines work against that variant.
Exactly 1 year ago today, UF Health Jacksonville's former CEO, the late Dr. Leon Haley Jr., rolled up his sleeves and got the first COVID-19 shot in Jacksonville. At the time, hospitals were packed as the nation fought the original COVID-19 strain. Then came the deadlier Delta and now Omicron. Dr. Chirag Patel with UF Health Jacksonville says regardless of the strain, the vaccine is still the best defense against COVID.
Where does 2 doses of the vaccine stand against the Omicron variant?
Yeah, so in this case, we're really talking about the Pfizer vaccine. There's not a whole lot of data out from the other manufacturers. Here's what I'll say globally. The vaccine is doing its job in preventing severe infection and death at a very high rate in both the fully vaccinated and then especially those who've gotten their booster.
According to Pfizer's new findings, 2 doses of the vaccine provide just 33% protection against Omicron infections, but 70% protection against a hospitalization, which is why medical experts like Dr. Fauci say it's vital to get the booster.
There's no doubt that we can say that optimal protection when you're dealing with an mRNA is with 3 doses. There's no doubt about that, both for the durability of the protection as well as the protection against the Omicron variant.
Some good news from Pfizer today about their COVID-19 pill. Now, the pill would be prescribed by a doctor and be used to treat COVID-19, and the results are promising. The company says full results of its 2,250-person study confirms the drug reduced hospitalizations and deaths by about 89% for high-risk adults. That is, if the pill is taken shortly after the first virus symptoms. And that's far more effective than Merck's COVID-19 pill, which cut the risk of hospitalization or death from COVID by about 30%. But Dr. Patel says the best line of defense to not being hospitalized or dying from COVID is not getting the virus in the first place.
So go out there and get your vaccine.
Lauren Verno, Channel 4, the local station.